Hello, how are you? Many people who use weight loss pens like Saxenda, Ozempic, Mounjaro, or Wegovy don't realize that there are mistakes they make in their daily routine that can harm their health or even affect their treatment, adherence, and weight loss results. I'm going to tell you here what the 10 main mistakes are that many people make so you don't make them too. Stick around until the end because you won't want to miss this. Before we start, I want to ask you if you use or have ever used any of these weight loss pens. If so, which one? And how was your treatment? Did you get good weight loss results? Did you regain the weight after you stopped or not? Write everything for me here in the comments. I love reading your comments. If you can, go ahead and leave a like on the video. This is really important for me here on the channel. And if you know someone who uses these pens, share the video. It'll help that person too. Let's expand our chain of kindness. The first mistake many people make is eating too many fatty foods. And I say this because sometimes a person really is eating a small amount, but they're not paying attention to the quality of their diet, their daily food, their day-to-day meals, and they end up eating little, but a lot of fatty foods. So for example, peanuts, nuts, especially those peanuts with a coating, fried foods, fast food, bacon, very fatty cheese. People sometimes think that cheese is very healthy, and when they do eat it, they eat a big piece of cheese. It can stay in your stomach for a long time. We know that these medications, one of their key effects, one of the ways they act in our body is by slowing down the rate of gastric emptying, which can influence digestion and satiety. And fat already has this ability to slow down the digestive process. So if you're taking medication that will slow down your digestion and you eat a very fatty diet, you may experience many more side effects. Nausea, a feeling of heaviness in the stomach, reflux, that sour taste in the mouth, even that rotten egg burp that some people mention, and that bloated feeling after meals. You end up feeling really unwell and don't realize that even though you're eating little, the quality of your diet is poor. Of course, it's also worth mentioning that consuming more fat is very, very calorie dense. So this can hinder your weight loss results. I say this because there are people who take the pens and say they've hit a plateau, that they're not able to lose weight. Sometimes they take it for diabetes and say, but I don't lose weight with this pen. Because they haven't changed this in their diet, and sometimes they eat a lot of peanuts, a lot of peanut butter, very high calorie foods, and they're not paying attention to this detail. The second mistake is skipping meals or eating almost nothing throughout the day. There are people who basically fast the entire day, eat very little during the day, and go hours and hours without eating. This can cause hypoglycemia and rebound hunger, which may lead you to want to eat a larger amount at night, which is exactly when you shouldn't be eating that much, right? It can harm your sleep, your metabolism, and everything else. So ideally, you should try to eat. Not even necessarily at set intervals because that's very individual, but at least 3 balanced meals a day. They don't even have to be large portions, but you should always be stimulating your gallbladder to work, ensuring proper digestion, proper secretion of enzymes and gastric juices so your body functions well to avoid hypoglycemia and to prevent that ravenous hunger that some people don't feel during the day but end up feeling at night. A very common mistake is also not hydrating properly. We know that the thirst center is close to the hunger center in our brain, and since these medications can decrease your appetite, sometimes they can also reduce your desire to drink water. And many people also, sometimes because they eat less, end up hydrating less since they have the habit of drinking more fluids during meals. So this is very bad because hydration is basically necessary for everything in our body. And when water intake is low, it can also worsen constipation, which is often associated with these weight loss pens, in addition to causing fatigue, headaches, a feeling of weakness, and an overall decline in the digestive process. So remember to keep yourself hydrated. Always have a water bottle with you throughout the day, and actively remind yourself to stay hydrated. It will really help you. Of course, we can't avoid talking about a very important mistake, which is forgetting about overall food quality. When we think about weight loss pens, you have to consider 3 basic pillars. First is protein, because people tend to consume very little protein and very few calories. There are people who eat so little that they can actually enter a state of malnutrition, and then they may experience associated muscle mass loss. So ensuring a good protein intake is very important. Milk, cheese, eggs, meat, legumes, not all of these at once, but always making sure to include protein. Protein supplements can also be a good option if you have little appetite. Another point is to consume fiber. You know that people tend to be more prone to constipation. So ideally, you should eat foods that are naturally rich in fiber, such as vegetables, fruits, legumes, leafy greens with their skins and all, or even chia, flaxseed, psyllium, more fibrous foods, while staying well hydrated, as I mentioned, to stimulate intestinal transit, which is also important. And of course, vitamins and minerals. How many people do you know who use the pens and said their hair started falling out, or sometimes they get sick, catch a cold, or say their skin is really dry? That's because obviously they're not able to eat much, and when they do, the quality isn't that great, so they end up losing vitamins, minerals, and antioxidants, which are important. You usually get those from vegetables, greens, and fruits. So remember that the pen helps you lose weight through a calorie deficit, but when you eat, it has to be a balanced diet. That's why your local nutritionist, their guidance can really help you a lot in this regard. Another mistake is continuing to drink a lot of alcoholic beverages very frequently. We know there are two problems here. First, alcohol can irritate the stomach lining and interfere with digestion. And since these medications already delay gastric emptying, it can worsen one of those symptoms I mentioned to you: nausea, reflux, discomfort, and so on. Besides that, alcohol also has calories. We tend to forget, but 1 gram of alcohol has 7 calories. So sometimes a person says, I just can't seem to lose that much weight, but they keep drinking a lot of alcohol. Not to mention that alcohol lowers inhibitions and can make you snack. Sometimes you're not even hungry, but you end up eating out of habit because you associate drinking alcohol with having snacks. So be careful about that. It's also crucial to mention the mistake of self-adjusting medication. Occasionally, patients get impatient with the process and decide to increase their dose prematurely to skip the adjustment phase. This is something you should never do without consulting your doctor. Or, this medication stopped working, so I'll increase the dose. Never increase the dose on your own. This can be dangerous for you. And also, don't stop taking the medication on your own. Ideally, there should be a titration. The person should gradually increase the dose, step by step, and the doctor will adjust it accordingly. And when it's time to discontinue the medication, you should also taper off gradually to avoid a rebound effect. Of course, a very important mistake to mention is putting all your weight loss expectations on the pen without changing your habits. Eventually, you will lose weight, even if it's just a little. But remember that the pen shouldn't be used for your whole life. It's a medication that will help you until you reach your ideal weight. And ideally, after that, you shouldn't need to use this pen anymore for your health and also because of the cost, since these pens aren't cheap. So remember, if you don't learn during this process, when you're already feeling less hungry and have all this metabolic help to lose weight, it will be worse for you later on. So remember to maintain a balanced diet, physical activity, and adequate sleep so you can have this tripod to support you when you stop taking the medication later. There's another mistake that's important for us to mention, which is improper storage of the pen. Some people leave the pen out of the refrigerator, forget it outside, or use it past its expiration date. In these cases, it might not be effective. So, be very careful with storage to make sure that the pen you invested so much money in will work properly. There's also the mistake of incorrect application. Some people don't rotate the injection sites properly. It's not ideal for you to inject in the same spot every week because it can cause fibrosis, lipodystrophy, nodules, and it can even impair the absorption of the medication itself. So, the ideal is that you actually rotate the sites, and your doctor will definitely tell you which are the best areas for you to inject in your case when they prescribe the pen. The last mistake, which is a very common one, is people who don't do weight training or strength exercises when using the pen. It is very important that you do weight training. It will ensure the acceleration of your metabolism, help maintain lean muscle mass, and maybe even promote some hypertrophy if you manage to do proper weight training with professional guidance and good protein intake. It will also prevent sagging because weight loss is usually fast, so it helps in several different ways. So remember once again not to put all your faith in the medication and think you don't need to do anything else, just sitting there. You will get results, but for sure, they won't be as good as they could be, both aesthetically and physiologically and metabolically as well. Tell me if you noticed that you were making any of these mistakes and which one you're going to change today. I would love to see your comment. Remember that this video is for informational purposes only. If you have any questions about these medications, talk to your doctor in your city. If you know someone who uses these medications, share this video to help them out and leave your like on the video. See you next time. Bye.